news on CNN, actor Dwayne "The Rock" Johnson saying he and his family have tested positive for the disease, but also saying they're now fully in recovery. I want to discuss now with CNN's chief medical correspondent, and that is none other than the Dr. Sanjay Gupta. Doctor, thank you so much. Dwayne Johnson says his family got the virus from a close family friend who unwittingly infected them. I mean, it really goes to show you that people can get the virus even from people very close to you. You may not even know they have it. Most of the time, you don't.
Yeah, I mean, because they don't have any symptoms. You know, if you have symptoms, you should be staying at home, right? So a significant amount of the spread in this country is coming from people who don't have symptoms, don't realize they have the virus because they can't get tested, and then spread it. I mean, that's been the problem sort of almost all along, Don. And I think a lot of families, a lot of people who are watching right now may say, look, we're having friends over, they've been totally safe. And maybe they have been, but everyone still has to behave like they could potentially have the virus. Even if you've got tested, if the test was positive, you should isolate yourself. But if the test was negative, you still have to behave like you could potentially have the virus because the test could come back positive the next day. So for the time being, you know, as Labor Day weekend comes up, you think about having friends over, be careful. Keep the distance, wear the mask, do all the things that we've been talking about for months.
I think we all get a little lax as it goes on, because I mean, I've told you, sometimes I forget the mask and then I have to turn around. I'm like, oh, I forgot my mask. So now I keep extras. But I think people just, you know, as this goes along, you get a little bit lax and you think, oh, well, maybe it's not going to happen. But we all have to be really careful. Can we talk about this vaccine? The director of the NIH, Sanjay, now saying a vaccine by October is unlikely, despite guidance from the CDC to states to prepare for that. What's going on here? I mean, how do people make sure that this timeline isn't being influenced by politics, as so much is in this country right now?
It's really hard, Don. I mean, this is one of the most challenging stories I think I've ever covered for that reason. And you got to take these things in context, right? I mean, the FDA had this issue with hydroxychloroquine. They gave an authorization to a drug that had no evidence. They exaggerated the data around convalescent plasma. So these are a problem, and that erodes trust to some extent. So they're going to have to build up that trust. But there is one thing I want to make clear is that, you know, when it comes to authorization of a medicine for someone who is really sick in a hospital, that's a different sort of bar. With the vaccine, as you well know, Don, you're giving it to healthy people, right? So the bar's got to be higher. You can't make people sick who are healthy in order to potentially rush a vaccine. And also, when you authorize something as an emergency, it's because you're basically saying there is no viable alternative. Well, Don, even though, you know, people don't necessarily want to do this, the viable alternative here is that, as we were talking about, you wear a mask longer, you keep the distance longer. Do that a few months longer until the vaccine is nailed down. I think that's you know, I think what a lot of people are hoping happens. We're very clear on the safety and the efficacy before this thing's approved.
Let's see. I want to play this for you because the president, Sanjay, was in North Carolina today, and I want you to check out this video. It's a big crowd. It's near the president. There's no masks, no social distancing, not the example that you would like to see from the American public and from the president. Right? They're there with the leader of the free world, and they are not social distancing. I don't really see any masks. There may be one or two, but I can't really see. I mean, wow.
No, and you know, one thing, Don, whenever we show this, you know what I immediately get tons of emails and tweets about is that, well, what about the protests and what about the march and stuff like that? Sure. Anytime you aggregate people together in the middle of a pandemic, bad idea. Do it without masks, worse idea. If it's indoors, even worse. I mean, these are basic viral dynamics. The virus doesn't care. The virus just wants hosts, jump back and forth. But here's the thing. The vaccine, as Dr. Hasselstein was saying earlier, has sort of become the Hail Mary, right? We can do whatever we want because the vaccine will come, you know, hopefully within the next couple of months. I think a lot of people do want a vaccine. I'm not trying to minimize the potential impact of that. But that's never meant that we should abandon these public health practices now. And frankly, even after the vaccine is approved, we're still going to, for a period of time, need to adopt these public health practices because you're not going to immunize everybody right away. So That's just, it's not acceptable. And the president, and everybody, needs to be sending that message right now. The president's not sent it right at all. I mean, they had the event at the White House, 1,500 people sitting next to each other for a long period of time. That's a problem. Yeah. People will get infected as a result of events like that.
Listen, you expect, you hold the leader of the free world to a higher standard than you do anyone else, quite frankly. And it's not as if we don't talk about those protests being possibly super spreader events. We discuss it all the time on this network, especially right in the middle of the George Floyd and the big protests, what have you. So it's always something. They're always going to be criticized. Thank you very much, Sanjay. I appreciate it. I'll see you soon. I want to bring in now Dr. Harold Varmus, a former director of the National Institutes of Health. He is a Nobel laureate for his work in cancer research, and he is now publicly calling into question the CDC's credibility. Dr. Varmus, good to see you and to talk about this. So here's the headline from your recent op-ed, okay?
Thank you, Don.
Thank you. It has come to this. Ignore the CDC is what you say. That's a big deal. Tell me why you say that.
Well, look, the headline was not written by me. The headline was written by the New York Times, and it has the virtue of attracting readers. But we're not going to ignore the CDC. The CDC is an important institution. I think we need to be extremely cautious about what's being said these days because it's not entirely clear where these proclamations are coming from. And in this case, when the CDC changed its guidelines with respect to the testing of asymptomatic people, just the topic that you were talking about with Sanjay Gupta, it is critical to recognize that what we're all about, whether you're wearing a mask or using protective equipment or testing people, the basic idea is to try to keep people who are infected away from people who are not, so the virus can't get transmitted from one person to another. Testing asymptomatic people is crucial. If we had the resources and we had the time and the personnel, we would test every person every day. That's not feasible. But we can do some reasonable testing of asymptomatic people, testing people who are likely to be aggregating, as you point out, at political events or at sports events, testing people who have no symptoms but are known to have been in contact with someone who did have the virus. These are very reasonable very reasonable priorities to set when using our precious testing resources. And this needs to be done much more broadly because the goal is to identify everybody who's infected whenever they're infected and ask them to be, and in fact insist that they be separated from other people.
Yeah.
As Dr. Gupta was pointing out, the goal for the virus, to the extent that it thinks about anything, is to try to get to a new host and grow in that new host. And we're trying to get rid of the pandemic by preventing that from happening.
Well, you gave a lot of information and answer. You basically answered like 4 of the questions I had for you. So in that amount of time, so you were very concise, and we appreciate you coming.
Let's not cut down the time and go on to other things.
No. Unfortunately, it's television. I have to do it. But we will have you back because I love the information that you give and your honesty and your candor, and we appreciate you coming on. Thank you so much, Doctor.
My pleasure.
Speaker Nancy Pelosi caught on camera not wearing a mask at a San Francisco salon. And take this, she's calling it all a setup. But shouldn't she know better?